We can speak to Dr. Mohammed Abu Mughisib, who is the Deputy Medical Coordinator for Médecins Sans Frontières in the Gaza Strip. He joins us from the Mawasi area. Dr. Mughisib, thank you very much indeed for speaking to us. I mean, we heard reports of more deadly bombardment in eastern areas of Gaza City overnight. Just tell us what the latest has been in the last 24 hours.
First of all, thank you for having me. I mean, the airstrike and bombard didn't stop. I mean, since the beginning, actually, of the war. I mean, it's a daily event. But yesterday was very heavy in Khan Yunis area. I mean, there was heavy airstrikes in Khan Yunis. I mean, in Gaza City in the north. I mean, the Gaza City itself. I mean, speaking to you now, I mean, the hospitals which are functioning now in Gaza, the bed occupancy, I mean, there is no more beds for patients at all. I mean, now the patients are lying in the corridors and the floor in the emergency department because there is no space for the injured anymore in all the hospitals, whatever is structured hospitals for the Ministry of Health or the field hospitals which are run by the international NGOs.
Okay, and of course, we've been covering this story, consistently here at Al Arabiya, and it's been reported that more than 60,000 Palestinians have been killed during these last 22 months. We hear that more children are dying of starvation and malnutrition in the last 24 hours. Just tell us, what's the latest with regards to access to food at this particular moment?
I mean, since the last few days, there was some aids entering into Gaza. But actually, I mean, this is not really proper food. First of all, the number of trucks which are entering or the aids are not enough. You know that Gaza needs at least 500 trucks of goods entering every day. And now around 20 trucks entering. This is it's just a drop, actually. And the material that is entering is not a proper nutrition. I mean, it's only flour, cooking oil, and rice and pasta. I mean, what is missing is the proteins, the milk, which is not entering, the fruits. So, I mean, still there is a huge acute hunger in Gaza. I mean, the trucks which are entering they are looted as well by some gangsters in here in Gaza, or by the population who are in deep hunger. So still the markets are semi-empty. The prices are high, and still we are seeing malnutrition cases. I mean, among the young children, among the pregnant women, lactating women, elderly, even normal people like us. I mean, we are still having one meal per day.
Sure. I mean, I was going to say, I mean, we're being told that 1/3 of Gaza's population has now gone several days without eating anything at all. I mean, are you getting the impression things are getting worse by the day, or have things remained pretty consistent, would you say, in the last week or two?
I mean, there is little bit improvement in you can see, I mean, sugar you can see now in the market, you can see rice in the market, you can see flour in the market. But again, I mean, not everyone can access to buy it. I mean, people, the poverty is high. There is good signs that some charity kitchens started to work again, but as well still, I mean, it's not the proper nutrition. I mean, again, you need for normal people, normal nutrition. I mean, you need protein, you need the vitamins. This is not available in the goods which are entering in Gaza until now.
So what does that mean? Does that mean that hunger and famine are perhaps averted, but that doesn't mean that malnutrition is being averted? Is that roughly where we are?
I mean, we were on the edge of famine. I mean, it was almost a few, days, and we had to declare famine in Gaza. I mean, with the entry of few goods, I mean, we are not far from declaring. But the malnutrition didn't end. I mean, still, I mean, there is. I mean, what you see for example, the children. I mean, there is children dying from malnutrition, and yes, they have underlying disease, but doesn't mean that, I mean, if they have underlying disease, they shouldn't die. I mean, they have to have special protein, special formula milk, which is not entering. And there is some accusation that no, they have underlying disease, they have some comorbidity, genetic problem. Yes, but they were not supposed to die. I mean, if the goods are entering, formula milk entering, special nutrition are entering, these children will not die even in the hospital.
You're a specialist in mental health care as well as being a practicing doctor. Just tell us how widespread mental health issues are there in Gaza, and what sort of mental health issues we're talking about. Are we talking about trauma? Are we talking about depression? Tell us a bit about that aspect.
I mean, in what I can say to you, I can confirm to you that the 2 million people in Gaza have psychological problems already. I mean, I cannot say you which term. I mean, we have to really create, all the mental health experts need to create a special term for the Gaza syndrome. I mean, they have mixed anxiety with trauma, with depression, with panic, with insomnia. I mean, all of this are people are witnessing and having all the time. And so we really need to find a way to create really a new term for Gaza in mental health. The situation is really bad. People are living since already 22 months of continuous bombarding. They are displaced from their homes several times. They lost friends, members of the families. They are starving. I mean, all of this each person in Gaza has suffered, whatever is a child until elderly.
Yeah, and I wanted to ask you, Dr. Mughisib, I mean, not to mention the fear of living in tents and having explosions going off around you, seeing horrific scenes every day, seeing fellow human beings maimed or dead, perhaps on a regular basis. I mean, what's that going to do, particularly to children, in the long term?
I mean, first of all, we hope that there will be an end of this war. And then later, I mean, we will need decades really to work on the psychological impact that the population had, and especially children. I mean, children had some of them has been born in the war, raised in this war, and nothing they know in the last 22 months except the bombing, the airstrikes, the starvation themselves. They are asking for bread. I mean, in Gaza, we never witnessed children asking for bread in the street. I mean, so I think the expert of mental health, need to really work on supporting the population after the ceasefire.
And just before we move on, I mean, there aren't any educational facilities functioning, are there? I mean, it's being reported 97% of schools have been destroyed. So presumably, the daily reality for a child in Gaza is a battle to survive.
As you mentioned, Tom, I mean, there is no kindergarten, there is no schools, there is no university, there is no education since 2 years. I mean, there is no one is going to, I mean, even online, there is no a way to do online even studies. I mean, with the present condition, people living in tents, and there is no internet in some huge areas. So, I mean, the children here, they are standing in queues to bring water, to fill their jerrycans of water. They are standing in queues in the charity of these kitchen charities to get some food. I mean, this is what they are now raising. I mean, the entire population has been really destroyed socially and psychologically.
I mean, Israel continues to dispute a lot of the facts that come from the ground in Gaza. They dispute the fact that there have been malnutrition fatalities. They deny, some of the ones we speak to, that there is any shortage of food. I mean, what do you say to those kinds of denials?
I mean, first of all, about the children who are dying from starvation. I mean, they mentioned that these patients are having some diseases, genetical diseases or other cardiac diseases. Yes, they have another disease, and they need special formula, milk, or special protein supplement. That doesn't mean that they have to die. No, I mean, they are dying because there is nothing entering, and this protein and this formula milk is not entering. Israel is blocking it to enter, so that's why they are dying. I mean, yes, they have comorbidity, so they're not supposed to die. Regarding, I mean, the foods, I mean, you can come to the market. I mean, allow the people to see the market. There is no fruits entering. There is no protein. I mean, there is no eggs. There is no milk. I mean, what is entering in the last few days? Few trucks of flour, cooking oil, pasta, rice. That's what is entering, and sugar.
What about you personally? I mean, what sort of access to food do you have? And have you found that your weight has decreased sharply in the last few months?
I mean, everyone, it's not me. I mean, everyone who in Gaza lost weight. I mean, there is nothing in the market to buy. I mean, it's not that we cannot afford it. No, there is nothing in the market to buy. So, I mean, now I'm eating one meal. I mean, and my colleagues are eating one meal per day, and we are lucky to have this one meal. I mean, but this is not even a proper nutrition. I mean, we're having rice, pasta. Now we have sugar with the tea. I mean, we can have little bit sugar to have little bit calories, but it's not a healthy food at all. I mean, you don't have proteins, you don't have eggs, you don't have cheese, you don't have fruits. I mean, it's since March.
And all the while, the Gaza Humanitarian Foundation continues to operate. It's been described by Human Rights Watch as being a death trap for people who go to those sites to collect their food, because there have been reported shootings, deadly shootings at their sites. I mean, is the GHF, as it's called, the Gaza Humanitarian Foundation, is it getting more effective at distributing aid, or is it remaining as deadly and as dangerous as it was before for people who go there to collect food?
I mean, until today, I mean, there is people dying from gunshot injuries in the distribution points. I mean, since the beginning, since the GHF opened, I mean, it was not, I mean, they opened 4 sites. I mean, before it was 400 sites run by the UN to distribute for the population. Now that's four is not enough for the population. There is no organization. It's humiliation. I mean, you saw on the TV, I mean, how the people are gathered there, and I mean, in a special area, they have to walk, and then they are going early and they are shot. If they go at the time, they are shot. And if they go late, they are shot. So we had a lot of patients that we received in our facilities, in our clinics, in our hospital, who have been shot and injured by during their trip to the GHF to collect food and parcels of food.
So can you be sure, Doctor, that the people who've been shot at GHF food distribution points have been shot by Israeli gunfire and not by saboteurs or other militants in the area?
I mean, from the patients that we treated, I mean, they were clear saying that they were shot from the side of the Israeli side. The shooting came. I mean, the warning bullets or the shooting. And I mean, there was as well some people who were working with GHF, I mean, that said it clearly.
Are the aerial food drops making any difference to the situation there? There have been some countries that have delivered food from the air to Gaza. Is that helping at all?
I mean, airdrops were meant for, areas, rural areas and remote areas where there is, mountain people living in a remote area in the mountains or in the Sahara. You can drop for them food, or aids. I mean, here the population is 2 million people who are squeezed in 25% of Gaza Strip, which is actually a small area already. All of them squeezed. There is tents everywhere. When you look from the window, you have tents everywhere, people and IDBs. And dropping it, I mean, it's killing people. I mean, it's not really the way that aids. I mean, there is a way, there was a system. I mean, there is terminals, I mean, in between Gaza and Egypt and Israel, that through these terminals, trucks can enter and can deliver. And the system was running.
Sure, and we've seen pictures of people being injured or killed by parcels of food coming from the sky. It's, as you say, it's extremely dangerous. You touched on what sounds like a quick fix in terms of opening the Rafa border crossing between Egypt and Gaza. Is that something you think is likely to happen?
I mean, we hope so. I mean, because trucks are standing in queues on the Egyptian side, and I mean, they need just the permission from the Israeli side to enter and to deliver aids. I mean, a lot of international NGOs, among them us, MSF, we have aids and trucks that are waiting on the Egyptian side. So, I mean, that will be the easiest solution to bring aid in Gaza, is bringing it through the terminals, like between Rafah terminal or other terminals that are in the north or the east of Gaza.
Yeah, and of course the aid that's sitting on the border there in Egypt, for example, it's not Israel's aid, it's aid that's being donated by, the international community. But Israel nevertheless says it's very worried about that aid being stolen by Hamas. Why is Israel so worried about that, do you think? And what difference does it make if Hamas steals some of the aid anyway?
I mean, I mean, now the population don't care who will steal it. I mean, they need that aids to enter Gaza. Even if the devil will steal the trucks, at least the devil will distribute the aids to the population. I mean, the population are desperate. I mean, since March, nothing was entering, so they don't care who will distribute the aid, and you know, they need just the aid to enter, and that's it. I mean, there is gangsters there is looting, there is, I don't know, several stories, but at least there was aids in the market. I mean, there was products in the market that the population were able to access.
Right, and if all of that food got through, it would bring prices down in the market, and it would make Hamas less powerful in a way, if indeed it is reselling some of the food on the black market at much higher prices. That would no longer be a tool at the disposal of Hamas, would it?
I mean, that's the logic, Tom. I mean, if there was a lot of goods entering to Gaza, I mean, the prices will be very low, and no one really, you know, have to use the black market anymore.
I just want to ask you, I mean, over the course of these last 22 months, is there one encounter or one person that you've met or one situation you found yourself in that you're simply never going to forget? I'm sure you've had several, but is there one that stands out for you?
I mean, when my family actually left Gaza, I mean, you know, my family managed to leave Gaza to Egypt, and that was a moment that I will never forget. I mean, all my family, my wife and my kids managed to escape this, you know, massacre here in Gaza, and now they are safe in Egypt since February. The moment that I said goodbye to them, it was really the moment that I will always remember, because I tried to leave after this, but then Rafah terminal has closed in May, and since that, you know, I'm waiting since 1.5 years. If the borders will open again, Rafah will open, I will try to reach them and join them.
Right, so you're saying you would leave as soon as you could, were the opportunity made available to you.
Yes.
What about a patient you've met, a child, a mother, someone you've met whose story and whose ordeal is one that's going to be in your mind forever?
I mean, a girl of 6 years old, I mean, that was injured in Rafah, and she was admitted in our field hospital in Rafah at that time in February, I think February 2024. During an airstrike, she lost her parents, both father and mother and siblings, and she was admitted in our hospital with her auntie as a caregiver, and she wake up from the surgery, and no one of us were able to tell her, to disclose that she lost her parents, she lost her siblings, and now she's an orphan. And they approached me, the team, and they know that I have mental health experience, and I can little bit disclose this to the child. I went in front of her and I looked at her, and I was frozen. I couldn't say to her that I couldn't disclose this information to her. And you know, she's a beautiful young girl, blonde. You know, it was rare in Gaza, and she doesn't know that her father and mother and siblings died during the airstrike.
Where is she now? What's her name?
I don't remember really the name, and she's now with her auntie, but I don't know where, because we were obliged in May to evacuate as well our field hospital in Rafah. We had a field hospital that we were obliged to evacuate it when the ground operation started in Rafah.
Okay, well, I'm being told we're out of time, but we really appreciate you taking the time to speak to us, and we wish you and your family all the very best. Thank you for your time. Dr. Mohammed Abu Mughisib, thank you very much again.